Hello, this is Dr. Williams, and this lecture will give a brief overview of theory in nursing. So as we go through this lecture, there are some objectives that we will cover. We will be looking at how to redefine some of the key concepts used in nursing theory. We will examine the process that is utilized for it. We will also talk about some frameworks. We will look at the relationship among research, theory, and practice, also referred to as the triad. So let's get started by talking about the concept of concept. Think about terms that refer to things such as phenomena or caring. So what we're going to look at is how do we define concepts and why do we need to? It is important to note that oftentimes a concept by itself can be very abstract. So defining concepts allows us the opportunity to bring clarification to symbols, statements, and even phenomenon. Our goal with defining concepts is to look at them and determine just some of the basic clarity of, is this concept an abstract concept or is it a concrete, right? Is it variable or invariable? And does it apply theoretically or operationally? And we will talk more about that as we go through the lecture. I would like to kind of review a little bit when we think about the American Academy of Nurse Practitioners, the AACN organization, how they find it very important to clarify for the profession of nurses the importance of concepts such as clinical judgment, communication, compassionate care, diversity, equity, and inclusion, ethics, evidence-based practice, health policy, and social determinants of health. So take a minute and think about those 8 concepts I just mentioned. And think about, depending on who you are, your background, your knowledge, your expertise, your profession, these concepts can mean different things. So defining concepts, especially within the field of nursing, helps us to clarify and reduce some of the ambiguity that may exist when speaking about any of these concepts. When you think about concepts, think about where did that concept originate from? One of the things about nursing is that we have evolved over the years. We have borrowed concepts from different specialties and different professions, such as biology, environmental, medical, and with that, it does require us to take a look at if the way those concepts were defined, do they actually apply to nursing in the same manner? And if they do, or if they don't, what do we need to do to bring clarity as we use those concepts within the field of nursing? I want you to think it part of that process and part of that development includes things like concept analysis, concept development, and concept synthesis. And these are all things that help to bring some clarity. And then the reason we do these is because we want to bring and promote understanding of these concepts as they apply in the profession of nursing. So let's start by talking about the purpose of concept development as it applies to nursing. It helps us to identify the gaps in our nursing knowledge. It helps us to determine the need to refine or clarify a concept when it appears to have multiple meanings. Concept development also allows us to evaluate the adequacy of the competing concepts and their relation to other phenomena, while also examining the congruence between the definition of the concept and the way it is operationalized, and determining the fit between the definition of the concept and the clinical application. And all of this is in the context of concept development. And then we have concept analysis, right, or concept development, which is the rigorous process of bringing the clarity to that definition. So it's not that we just develop a concept, define it, but we have to do some rigorous evaluation to be able to stand behind how we utilize these concepts. We look at things such as theories, how we operationally use these concepts to help us in that analysis. So what are some of the strategies of concept analysis and concept development? We have theorists Walker and Advent that talk about three processes: the concept analysis, concept synthesis, and concept deviation or derivation. So when you think about concept analysis, according to Walker and Advent, we're talking about the use of concepts that require a basic definition and clarification for research and scholarship. So that's the first part of the process. Then we have concept synthesis. This is used when concepts require observation or other forms of research for development. And then the third part of the process is concept derivation. And this is used when there are few concepts available to even explain a nursing problem. And then we have to examine the non-nursing phenomenon that may help us be able to develop and analyze a concept. So according to Walker and Advent, when you're thinking about doing concept analysis, there are some systematic steps you can do to help to analyze a concept. These steps include: you select a concept, you determine the purpose for the analysis. Why are you doing this analysis on this concept? You identify all the uses of this concept. You determine the defining attributes. What is specific or defining to that attribute? You identify a model case that demonstrates that concept. You identify borderline, related, contrary, invented, or illegal uses of it. You identify antecedents and consequences related to the concept. And then you define the empirical reference. So this is the systematic step process according to Walker and Advent when it comes down to concept analysis. Now, we also have a process by the theorist Rogers related to concept analysis. And according to Rogers, he has 6 steps or strategies that you utilize when analyzing and developing a concept. The first step is to identify the concept and their associated terms. What other words, what other terms are utilized to relate to that concept, or maybe even used in replace of that concept? Step 2 is select a setting or sample for data collection. Where can you collect information that's going to help you clarify the concept? Step 3, collect that data to identify the attributes of the concept and its contextual basis. 4, analyze the data regarding concept characteristics. 5, identify an exemplar of that concept. And then 6, identify hypotheses and implications for further research. So if you look at the previous theorists, Walker and Advent, and you look at the theorist Rogers, you see that there are some overlays in their processes and in their steps. So what are some other concept development strategies out there? There are several and many out there, theorists who have them. Another one is a hybrid method by Schwartz, Barcott, and Kim. They have what they call the theoretical phase, the fieldwork phase, and then the analytical phase. And it's just as it says, theoretical, fieldwork, and analytical. And then we have Malayius, who says when you're doing the development of concepts, he thinks of concept exploration, concept clarification, and then we have concept analysis. Okay? Then there is also the theorist Morse, concept delineation, concept comparison, concept clarification. And then there's the theorist Penrod and Humphrey that says principle-based concept analysis. So you can see that there are diverse theorists out there who have developed strategies or steps that will assist in concept development. I would recommend that you review and choose one that you feel you can relate to as you do your concept analysis. So now let's talk about theories. I'm going to just give an overview of theory, specifically focusing on nursing theory. Now, what is a theory? It is the unique theories and perspectives used by disciplines that distinguish it from other disciplines. So as I mentioned earlier, nursing has evolved over years, and we have borrowed theories from other professions and specialties. We do have theorists that have taken some of that historical perspective and created nursing theories, along with evolved some of the other theories so that they are now a little more applicable to our profession of nursing. Okay? Theories are important because they help to establish any profession as a discipline. It does this by clarifying basic assumptions and values and defining the nature and the purpose and the practice. So, as we think about what is a theory, like, can anyone just make a theory? There are some concrete attributes of what a theory is. So a theory is a systematic explanation of an event in which constructs and concepts are identified and relationships are proposed and predictions made. I'll say it again. It's a systematic explanation of an event in which constructs and concepts are identified and relationships are proposed and predictions are made. So it's not that you just have these constructs and these concepts, but you identify that they have a relationship with each other, and then you can make predictions based off of those relationships. Theory can also be defined as a system of interrelated propositions used to predict, explain, understand, and control a part of the empirical world. Okay? So as we look at theories, they are composed of these concepts, these propositions, and these laws. They can vary according to the number of elements, characteristics, and complexity of the elements, and even the type of relationship between and amongst these elements. They are invented rather than discovered. So let's kind of just test your knowledge a little bit. A tentative suggestion that a specific relationship exists between two concepts or proposition is a definition of what? Is it an assumption? Is it an epistemology? Is it a hypothesis? Or is it ontology? Correct. It's a hypothesis. A hypothesis is a tentative suggestion that a specific relationship exists between two concepts or propositions. So now let's talk about theory in nursing. Why do we need to use theory in nursing? It provides us with a structure and organization of our nursing knowledge. It is the systematic means of collecting data to describe, explain, and predict phenomenon that's important in nursing. It also defines and clarifies nursing and distinguishes nursing as its own profession. So how do we use theories in nursing? We use them to identify certain standards for nursing practice. We identify settings in which nursing practice should occur and the characteristics of what the model author considers recipients of nursing care. We identify distinctive nursing processes and technologies to be used, including parameters for client assessment, labels for client problems, strategies, planning, typology, interventions, evaluations, and evaluations of outcomes. Theory is also used to direct the delivery of nursing services, serves as a basis for clinical information systems, including things like the admission database, nursing orders, care plans, progress notes, discharge summaries, guides and develops the client classification systems, and it directs quality assurance programs. So let's talk about some of the terminology that we utilize in theory. So we talked about why theory is important. We talked about the impact of theory in nursing. Now let's talk about the terminology of theory. Other terminology related to theory includes empirical indicators. These are specific and concrete identifiers of concepts. Methods used to observe or measure the concept. We also have the hypothesis, which is the tentative suggestions that a specific relationship exists between the two concepts or the propositions. Further terminology of theory includes model, which is graphic or symbolic representation of a phenomenon, a paradigm, organizing framework that contains concepts, theories, assumptions, beliefs, values, and principles that form the way a discipline interprets the subject matter with which it is concerned. And then we also have phenomena, which is the designations of an aspect of reality. The phenomena of interest become the subject matter particular to the primary concerns of the discipline. We also have philosophy, a statement of belief and values about human beings and their world. Relationship statements. It indicates specific relationships between two or more concepts, maybe propositions, hypotheses, laws, or theorems. We also have worldview, the philosophical frame of reference used by a social or cultural group to describe the outlook on and beliefs about reality. So those are some of the terminologies that are used in relation to theory. So let's talk now about the stages of theory development in nursing. When we think about that, I want you to think about kind of like the historical journey of theory development in nursing. We have the silent knowledge stage, which was between the 1870s and 1940s. This is when education and practice were based on tradition, rules, and principles. This focused on technical skills, apprentice form of education. Think about the Florence Nightingale type era, okay? It was less concrete and less defined at that time. This is where the nurses, they trained in hospitals, and education was controlled by the hospitals and the doctors. So that was considered the silent knowledge stage. So now, let's ask a question. Tell me if this is a true or false statement. In the silent knowledge stage, emphasis on nursing education grew following publications of the report of the Nursing of the Future by Esther Brown. Is that true or false? So I want you to think. The silent knowledge stage was the emphasis on education and publication. We know that's false because what we know is The silent knowledge stage was early in nursing education, right? And it was more ambiguous, okay? We also have the received knowledge stage. This was between the 1940s and the 1960s. This is where we had a serious nursing shortage. It was when the Hill-Burton Act increased the needs for nurses. And Nursing for the Future was published. It promoted nurses getting an education in universities. This is when we began to start to have testing and registration. Nursing research was first published. Books on nursing research and theory were also published during this stage. There was slow growth of graduate education. However, it was beginning to start. This was the received knowledge stage. We then have the subjective knowledge stage. This is during the 1960s and 1970s. This is when we had articles published on theory development and theory for a practice of a discipline. This is when the number of nursing theorists began to grow. We leave the subjective stage and then move to the procedural knowledge stage. This was the 1970s to the 1980s, about 85. This is when nursing was viewed as an academic discipline. Theories now became the framework for nursing education. Again, more theories began to get published, and then we had consensus developed regarding the common elements of nursing. What was nursing? We had this consensus that things like person or client, health, nursing, and environment, these concepts began to become common elements within our field of nursing. We then moved to our further in the procedural knowledge stage, which we had where books were starting to be published as well. We had books that included the evaluation and critiquing of theories, the application of theories, and the construction of theories. Now, after that, the procedural, we got to the constructed knowledge stage. This was about 1985 to about 2010, a little bit after. This is where they began to recognize that nursing theory should be based on prior empirical studies, the literature, and the client experience and feelings. There was an incorporation of philosophy of science courses into our graduate programs, and we began to develop the middle range and practice theories. And then once we got past about 2010 and on, we then came to the integrated stage of theory development. During the integrated knowledge stage, we began to focus on evidence-based practice, continue to the development of middle range and situation-specific theories, and there was attention on translation of research into practice. So we're not just talking about gaining the knowledge, but how do we translate that knowledge into nursing practice? Now let's talk a little bit about the scope of theory. Now, when we think about the scope of theory, we have meta theory. That is a theory about a theory. In nursing, meta theory focuses on some of the broad issues. We think about our philosophical issues and our methodological issues. Philosophical issues are things like the philosophical worldviews, nature of health and man, appropriate level of nursing theory, whereas methodological issues look at the process of theory evaluation and the processes of knowledge development. We now have the scope of theories also leading to not only what we call the grand theories, but also our middle range theories. Grand theories are more complex and broad theories. They attempt to explain broad areas within a discipline. They do have some very distinct characteristics. They're usually nonspecific. They usually are composed of relatively abstract concepts and propositions. They're not generally amenable to testing, and they may incorporate other theories. And grand theories probably were the first of theories to be developed. And then we move to what we call the middle theories or the middle range theories. These were a little more circumscribed than our grand theories. They contain a limited number of concepts that are operationally defined. They focus on a limited aspect of reality. The propositions may be tested through research, and middle range theories may be descriptions of a particular phenomenon. They may explain the relationship between phenomenons, and they can also predict the effects of one phenomenon on another. And then finally, we also have our practice theories. These are what we call our micro theories. These are prescriptive theories. They are situation specific. They are the least complex with the fewest concepts. They refer to a specifically easily defined phenomenon. They're limited to specific populations or fields of practice, and often use knowledge from other disciplines. So let's talk a little bit now. We've mentioned about our grand theories, our mid-range, and our practice. Let's talk about descriptive theories, okay? These are factor isolating theories. They describe, observe, and name concepts. They do not explain how or why concepts are related. They do provide observation and meaning regarding the phenomenon, and they can be generated and tested through descriptive research. There is also explanatory theories and predictive theories. Explanatory theories, unlike descriptive theories, they relate concepts or propositions to one another. They attempt to explain how or why concepts are related. They focus on the correlation or rules that regulate interactions, and they're developed through correlational research. That is our explanatory theories. Whereas predictive theories are situation relating. They explicate conditions under which concepts are related, and relational statements are able to describe future outcomes consistently. Experiential research is used to generate and test them. Now we have predictive, which I just spoke on, but we also have prescriptive theories. Prescriptive theories prescribe activities necessary to reach a defined goal. They address actions and predict consequences of interventions. Describe the prescription, the action or the intervention, the consequence, the type of client, or the condition. These are prescriptive theories. So what are some of the issues that we see in nursing related to theory development? One is we see the borrowed versus the unique. It's a debate over how nursing theories originally started from us borrowing theories from other disciplines and specialties. And if that theory was borrowed, is it as applicable to nursing as one that was developed specifically for nurses? And the question is often asked, should nurses only use those that were developed by nurses and prescriptive to nursing? And then there has been arguments to state that in certain studies that theories of other disciplines, we can share them, but should we routinely share those? And then where does meta paradigms even fall in place? So when you think about a meta paradigm compared to theories, they're separate. Meta paradigms are the most global perspective of a discipline, the primary phenomenon that are of interest to a discipline. They explain how the discipline deals with that phenomenon in a unique manner. So what are the characteristics of a meta paradigm? Domain is distinctive from other disciplines. It encompasses all phenomenon of interest to the discipline. Are perspective neutral. And what that means is concepts and propositions do not represent a specific perspective or worldview. They must be international in scope and substance. Most scholars and theorists consider nursing meta paradigms that exist should include concepts such as person, environment, health and nursing, health, and then some have added the caring. So nursing paradigms should have the concepts, according to most scholars, including these 5 concepts: person, environment, health and nursing, health, and caring. And as we mentioned earlier in the lecture, when you think about concepts, we have to define that concept because the definition can differ depending on, as we mentioned before, the person, their background, their education, their knowledge base, their culture. So we have to make sure that we have clear definitions for each concept. When we think about nursing and the word person, we're talking about a being consisting of physical, intellectual, biochemical, and psychosocial needs. A human energy field, a holistic being, an open system, an integrated whole, a being who is greater than the sum of its parts. So when in nursing you use the concept person, you're thinking about these 6 descriptors as defining what a person is. When we talk about health, health is defined in nursing meta paradigm as the ability to function independently, successful adaptation to life stressors, achievement of one's full life potential, unity of mind, body, and soul. That is health. Whereas environment is external elements that affect the person, internal and external conditions that influence the organism, significant others with whom that person interacts. It's an open system with boundaries that permit the exchange of matter, energy, and information. So now, let's do a knowledge check real quick. Which is not considered to be one of the major concepts of a nursing meta paradigm? Which is not considered to be one of the major concepts of nursing meta paradigm? Is it environment, health, nursing, person, recipient of care, or professionalism? I'll say that one more time. Environment, health, nursing, person/recipient of care, or professionalism. Which one of these is not a major concept in nursing meta paradigms? I know you all got this correct. Professionalism. The other 4 concepts are definitely considered major concepts of nursing meta paradigms. So, to conclude, just know that when we think about nursing, it has evolved over the years. Our ability to evolve has been grounded in not only the profession of nursing, how we practice, but our theory and research. And through that, we have developed theories which are built on concepts which must be defined. And we also have meta paradigms that are also foundational to the framework of our profession. So what I would like you to do now is take the time to review your textbook if you have not already done so, and further enhance your knowledge related to the development of theory, practice in nursing. And we will hopefully have a robust discussion in class further about the development of theories and concepts within the profession of nursing.